Hi, welcome back. We're going to pick up with breast self-examination for chart 2 for chapter 6. So, breast self-examination, this is what females should be doing every month to check for breast cancer or a lump, for cysts, for any sort of abnormalities. Okay, because of the location of the mammary glands, because it produces hormones, because it's really close to your lymphatic system. It's very, very easy for things like breast cancer um, to increase in size, become more problematic, and potentially spread to other parts of the body. So it's important that you don't rely on an annual physical to tell you if there's a lump or a mass in your breast. You need to be able to check on a monthly basis, know what they actually feel like, and see if there's any abnormalities. So I think this picture that I found really kind of sums up how you can and how you should do it. So you're going to do it once a month, generally a couple days after your period. So females between the time of ovulation and um, and their menstrual cycle, the breasts change shape, right? So generally, when they're at their resting phase, when they're not engorged with hormones or fully developed and ready to be ready to produce a baby, um, that their resting period is a couple days after the period is done. Okay, so you'll always lift your arm to be able to examine your breast. Then you use finger pads. It's really easy to do it in the shower, like if you use shower gel or shampoo or something, just so that you get a smooth glide and you can tell if there's any bumps, so you don't get confused with maybe getting caught on the skin or something. All right, and there's generally three main ways that you can make sure that you get every part of the breast examined. So there's an up and down motion where you literally just work systematically in rows up and down all the way across. Okay. Now, mind you, keep in mind this is also while your arm is raised. I'll repeat that. And then you can do it in a circular motion. So you start from the center, from the areolus, and work your way outward in a circular motion, kind of like sun rays, right? And you can do circles where you start in the very center and you work in a circle all the way around. Um, you should be looking for any deformities or discoloration, okay? Any change in texture or any sort of nipple deformation or leaks of fluid. Okay, so this all goes into a breast self-examination. If you ever go to an OBGYN, they can teach you how to do this. And generally, like I know I was taught this when I was, 18, and I went to a gynecologist. But they're really great at explaining this process. And they have literature that shows, pictures on exactly how to do it and what to expect. So, but that's a breast self-examination. That's what it's for, is to be able to get early detection of any sort of medical condition that would involve the breast. Also, guys can get breast cancer as well. It's not as common, but it can happen because you have mammary glands. They're just not developed. Okay. BUN, this is all capital as well, blood urea nitrogen. Okay, so I have an actual video. So everybody knows I like videos. But it's just a voice. Sorry. But I think it explains what blood urea nitrogen is, how your body makes it, and what we use that test for.
Blood urea nitrogen, or BUN. I want you to always refer to it as BUN and not BUN. Okay, and the reason for that is BUN stands for blood urea nitrogen. Okay, and our normal range for this for a healthy adult is about 7 to 20 milligrams per deciliter. So, like I said, it's always referred to as BUN, blood urea nitrogen. And let's talk about what that means. Okay, just those words, blood urea nitrogen, tell us what it is. Okay, so we talked about in our discussion of bilirubin that urea is the breakdown of ammonia. Okay, so urea is formed from ammonia as an end product of protein metabolism. So we take protein in, or we have protein in our body, and that protein is broken down into ammonia, And urea is the nitrogenous kind of waste product of that ammonia. Okay, and so to get rid of that, we actually send that urea into the urine and we excrete it through our urine. Because of this, we use BUN to evaluate kidney function. The urea, nitrogen will go to the kidneys and it will be excreted via the urine. If the kidneys are not functioning appropriately, then we'll see elevated levels of blood urea nitrogen. That's going to be the primary purpose of this lab, is to evaluate kidney function. Are the kidneys able to get rid of what they need to get rid of? So some of the indications for this are going to be evaluate renal function, and then remember, urea is a breakdown of ammonia, and so we can use it also to evaluate liver function. We can also use it to evaluate hydration. So think of the blood. The blood is primarily water, okay? And so if we have less liquid, less water within our blood, we're going to have a higher concentration of this BUN. Okay, and so as we see a higher elevation of this BUN, that could be a result of lower water within the blood. So we'll just have basically a higher concentration of this solute. Okay, and that so if you think dehydration, you can think low fluid in the blood, low water in the blood. So we'll have a higher concentration of these particles of this solute, this BUN, and so you would see a higher level of the BUN. If you think another reason this could be elevated would be a high protein intake. So if we have a really high protein intake, we're going to have a higher BUN as a result of the breakdown of these proteins. Okay, so that's really going to be indicated mostly for renal and liver function, but we could also use it to evaluate nutritional status as well as dehydration, okay? And they can also be used to evaluate hemodialysis therapy. So a patient who's on hemodialysis will be allowed to live in a little bit higher range of BUN, well, much higher range of BUN. And so when they go for dialysis, we're going to dialyze all their blood, and we should see the BUN kind of come down. Okay, so it can be really used to evaluate the treatment with hemodialysis. So some of the reasons, we already talked about some of the reasons that it's going to be elevated. Primarily, it's going to be elevated with decreased renal perfusion, decreased renal function, like acute renal failure, glomerulonephritis. It can also be elevated with hypovolemia or dehydration, hyperalimentation, and more specifically, if we're taking in a lot of protein, it can be elevated with diabetes. It can be elevated with congestive heart failure. Some reasons that it could be decreased would be severe liver disease, inadequate dietary protein. Okay, so those two make sense, right? If our liver is not working right, we're not going to be producing as much of this urea, and then we're going to see lower levels. And then also, obviously, if we're not taking in food, we're not taking in protein, we're going to see it lower. Critical values for this are going to be about 100 milligrams per deciliter. Remember, our high-end range for a healthy adult is going to be about 20. So if we get up to 100 in a healthy adult, that's going to be a critical value. Now, again, an exception for this is going to be a patient who's receiving dialysis. We're going to allow them to be at a bit higher range, and those patients need to be evaluated by a nephrologist, a nutritionist, to determine what's a good range for this patient. Hopefully this helps you understand BUN a bit more. Remember, BUN, urea nitrogen, is going to be the nitrogenous kind of breakdown of protein metabolism. So protein comes in, broken down into ammonia, and that ammonia then is broken down into urea nitrogen. That goes to the kidneys. We excrete it via our urine. So if our kidneys aren't working, we're going to see elevated levels. If our liver isn't working appropriately, we're going to see low levels. And that's kind of how we can evaluate how kidneys, liver are working, what's our overall nutritional status, what's our overall volume status. So normal levels for a healthy adult, about 7 to 20 milligrams per deciliter.
All right. So I hope that didn't overwhelm you. That was a lot of technical jargon. But ultimately, blood urea nitrogen, your kidney filters out urea and nitrogen out of your blood. So if you have an elevated level of urea and nitrogen in your blood, your kidneys aren't functioning. They're not filtering it out properly. So if your urea and nitrogen level in your blood is too high, your kidneys are potentially failing in some way, shape, or form. If your body is not breaking down or metabolizing ammonia properly to create urea and nitrogen, then that's your liver that's being dysfunctional when you don't have a high enough level of urea and nitrogen in your blood. So it's kind of a diagnostic tool to see if your liver or your kidneys are functioning properly. All right. So BX, so biopsy, this can be a capital B or a lowercase b. Okay, it's a procedure. So notice one of them has an uppercase and a lowercase. It doesn't mean it's necessarily an element from the periodic table, but You can write it either way, capital or lowercase. I highly recommend knowing this one. This is a really common abbreviation that we'll use in medicine, especially when you work in any sort of clinical setting, in a diagnostic setting. So hospitals, if you have like family care and you need to order a biopsy, you would abbreviate it as BX. All right. Degrees Celsius, this is kind of like degrees Fahrenheit, but a different system. So in Celsius, they go based off of the freezing temperature of water, which is 0 degrees Celsius. In Fahrenheit, which is our standard American way of doing things, it's 32 degrees. So Celsius, 0 is freezing, 100 is boiling. So degrees Celsius. C with a line over it, or the W with a forward slash, this means with. So I've seen it both ways. In medicine, I've seen the C with a line over it used more often, but in everyday, messaging, writing things, taking notes, especially in college, I did W with a forward slash for with. Okay. All right. Capital C, lowercase a, so this is an element from the periodic table, if you remember me pointing this out. This is really important for bones. It's what helps give it structure and strength. We get calcium a lot from dairy, from juice, from food that we eat. Calcium is very important with how our muscles work, producing energy. It all goes into it, right? So calcium, it's an element from the periodic table, has huge effects on our body. CAL, this is calorie. Now, this isn't like the calories that you see on the back of a box, because that would be a capital C and a lowercase al. There's 1,000 of these little lowercase calories in every calorie that you see on the box. So, on like the nutrition label on the back. So calorie is a unit of measurement for energy. So we measure calories to give our bodies energy. When we have too much energy, our body stores energy in the form of fat. So that's what calorie means. Okay. And the calories on the nutrition labels on your food, those are considered kilocalories, which have 1,000 calories in every 1 kilocalorie. Okay. But calorie that we're going to talk about is CAL, all lowercase. It's a measurement of energy. Cap or caps, this is a capsule. Okay, so if you've ever taken medication for headaches or antibiotics, okay, generally if you get ibuprofen, it comes in a little like red tablet. Okay, a tablet is solid. It can be coated, it can be uncoated, but it's solid, right? A capsule basically has 2 sides to it that connect. So if you've ever seen a pill that has a whole bunch of beads in it, or like little dots inside of it, like you could open it up, like if you twisted it, you could open it up. That is a capsule. That's a capsule. Okay. So the singular is capital C, lowercase AP, and then the plural is lowercase caps. All right. CAT, like a CAT scan. Okay, this is computerized axial tomography. And I actually want to pick up with this on the next video so I can show you exactly what this is and why we would use it. So stay tuned and I'll have another video for you.